So everyone, our presenter today is Lisa Paterson, and she's the principal consultant of Lisa Paterson Consulting. Her extensive career over the last 20 years includes grassroots community and youth work and developing projects and programming based on need using community participatory research. So she has a wide range of evaluation and outcome measurement experience to share with us, and she's also a fellow COP member. So with that, it's over to you, Lisa.
Right, good afternoon, everyone. I hope you can hear me okay. So today we're going to look at some monitoring and evaluation from a community development perspective. And as you know, monitoring and evaluation is a vital part of any project, demonstrating the extent which a project has been able to meet its planned objectives, helps ensure that resources are being effectively used. But unfortunately, I'm not going to be able to give you a one-size-fits-all for evaluating project impact and measuring outcomes from a community development perspective, as it depends on the nature of the work and the context you're working in. Community initiatives are not easy to evaluate, so there's no conclusive textbook technique that can be adapted for use on each project. But the starting point really is to assess impact is to be clear about the group you're looking at or the population. So to be very clear on that to start with. And what we can say is that community development activities do lead to changes in individuals and groups. But asking the question whether community development makes any lasting impression on whole populations is a little more difficult because fewer studies have been done on that scale. So some of the questions we're going to ask today are, does community work work? What difference does it make in terms of outcomes? And can the outcomes be attributed to community work interventions? So the importance of evidence of outcomes is it's not only confined to personal development, but community development is not simply about changing individuals, but it changes relationships with the service providers, and it changes the way engagement happens with a population, which can lead to access to services or improvements in service delivery. So we can see some observable changes in practices. So I'm going to look at some key aspects of monitoring and evaluation from a community development perspective, which I'm really hoping that it'll complement your own evaluation work. So to start with, I'll tell you a little story about when I worked in the UK. And I worked in various areas, and I was responsible for a detached youth work team. So detached work, if you're not familiar with it, it works outside of buildings and makes contact with young people in their own environment. So the tools are basically what you've got in terms of your verbal skills and that sort of thing. One of my members of staff worked with a group over several weeks in the local area, and eventually she took them on a residential weekend. And I'd seen the group in the community before and after this weekend, and they were a different group when they came back. They were taking responsibility, leadership, the group dynamics were different. I could really see a difference. But the question is, how do you measure that or describe something that you know is working, but what's actually happening in that group? I knew that the positive group work that had taken place over the last few weeks and on the weekend had had an impact. But if we don't explore this kind of thing, you can really fail to capture it and not show the different kinds of impact work's having. And I would say that this kind of impact isn't shown through random tests, but it's more using to measure it. You use more of an intuitive common sense. So at that point, I'll just see if there's any questions and hope everyone can hear me clearly.
Hi, Lisa. So there aren't any questions yet in the chat box, but we can hear you loud and clear.
Okay, great. So moving on to the next slide, which I'm sure people are familiar with this idea of the hierarchy of evidence. So in some ways, reliable evidence is seen as a product of the gold standard of research with a reliance on randomized control tests. But I'd argue that the inherent complexities of community interventions require a different kind of sophistication to assess impact. So bearing in mind that we need to be aware of when the hierarchy research could be limiting us, because community initiatives often include a mixture of strategies, So an initiative may be focused on changing individual behaviour, but it's also often part of an intersectoral intervention. So you've got multiple interactions taking place within most community settings, and that challenges the more simplistic linear relationship between cause and effect. So I'm seeing quantitative and qualitative approaches playing a valuable role in evaluating programs. And then we've got the next slide, please. I'm just thinking, how do you define science? So things not normally defined as scientific can be put alongside research. I would argue that a good observation is scientific, and we can place our observations alongside research. An observation gives us a credible picture of what's going on, and it can really help us test our own assumptions. Participant observation data provides a context for understanding data collected through other methods. And then you can use a variety of qualitative research techniques to measure impact. So if you take the next slide, the term voting with their feet is something that I picked up when I first started doing youth work from one of the people that inspired me the most. She always used to say to me that people will vote with their feet. So in a sense, people are evaluating something themselves by their presence or removing their presence from a program. So that's something that we shouldn't overlook. We should keep our eyes open as to who's using programs, why they're not using programs, and then verbal feedback. You might get some very informal verbal feedback, but that's building the whole picture. You might also notice that there's an underrepresentation by certain groups. For instance, maybe females aren't using a program, that kind of thing. So all this is adding to the picture. And of course, you can still use methods like the in-depth interviews, the focus groups, case studies, evaluation meetings, but just adding all this together can contextualize the work in a way that some of the other forms of research that we saw on the slide about the hierarchy of research, they don't do that in isolation, so putting it all together. So there's lots of informal evaluation that can give you more insight. So I was just going to give you an example of a project, for instance, that's aimed at reducing smoking. So you might ask the participants, after the work's been done, to place themselves in a line, and then in terms of their knowledge about the impact of nicotine. So you can say, on the scale of 1 to 5, where do you feel your knowledge has got to? And I've put another slide, the next slide. It's a very simple tool that you can use with people who might not like written work, or young people, and it's a before and after thing that you can do at the start of a program using the left column, and then at the finish of the program you can ask them to fill in the right column and use a key like the one at the top, or even draw little pictures. And the feedback from this kind of thing has come from workers who've said that you can actually start to see patterns in those sort of evaluation tools, but also it's helped them using things like this as an assessment tool to show them where they need to focus their programming and their work, where there's areas of gap in terms of people's knowledge. So the next slide, I wanted to give you a quick overview on the importance of project design in measuring impact. So if you include certain aspects in your project design, that's going to really help you evaluate impact. So your aim is to be very clear about what it is you're measuring. Probably familiar with the idea of a theory of change and identifying a theory of change, which means in effect that you can say that why doing something will lead to this. And it's a theory of change is used more in the not-for-profit government sectors to promote social change. We define our long-term goals and then map backwards to identify the necessary preconditions. So it means that you're able to lay out your sequence of outcomes that are expected to occur as a result of your intervention. And then from that, you can plan an evaluation strategy around tracking whether these expected outcomes independent evaluation. So is that okay, or is that a question? Sorry.
Good. Just me cutting. You cut out a bit for me. I don't know if you cut out for others, but just missed the last sentence or so.
Okay, so I was just saying there's a number of ways to substantiate a theory of change. The first would be a research literature. Second, independent evaluation. Third would be consultation with the population. Fourth, practice wisdom. And then 5, policy itself. Why is such a policy in existence? So as I said, with the theory of change, you work first by working out your program goals or desired impact and working backwards on an outcome pathway rather than in the conventional forward-orientated logic model. The other thing you might want to do in terms of project design would be to use a needs assessment to help you outline the program's aims in the first place, and that can create a baseline from which the change can be measured. But also a needs assessment is something I've used because it helps ensure the project goals and visions are clearly identified, clearly linked to the identified needs. So the value of planning projects within constructed model or framework helps identify the aims of the work. So the next slide is a very simple logic model idea. And as you know, a logic model helps clarify thinking to review activities and outcomes against your project aims and objectives. But once the project's underway, the model can be used as an ongoing tool to ensure activities are on target, make sure you can make any necessary modifications. But the other useful thing about a logic model is that you can select a particular aspect or component or parts that you want to evaluate, because often we don't have the resources to examine everything. And then from that, you can attach your evaluation questions to your logic model. So the next slide, just wanted to say something on involving participants and community members. I think I can't emphasize enough how important this is. So we can monitor and evaluate projects during both the project implementation process, so that'd be process evaluation, and we can also monitor and evaluate at the stage of completion, outcome or impact evaluation. So monitoring and evaluation during project implementation is important because it's one of the ways that we work to ensure that the stakeholders are really actively participating in all the project-related design and planning and research. It's really important in developing ownership of the project, as well as any of the changes you're trying to make in a community or in a population. So participation of those beneficiaries, if you like, in project planning, monitoring, and evaluation is really important. For instance, I've worked with communities to redesign housing projects and community facilities, and through that local information that people have given us, we've really avoided certain pitfalls that would happen in terms of design in buildings, added extra design facilities based on that local knowledge. We really wouldn't have managed to do that if we hadn't had that direct feedback. And then that feedback will, at that time, will let you see if you're having a positive impact in terms of what you're doing. So I've taken that kind of feedback through the informal feedback, but also through group work and focus groups and surveys. It really keeps the work on track, and it gives you that feedback as you go along. So the next slide, just wanted to give you some examples and reminders of the short-term and intermediate outcomes and how you can divide them up. If you take short-term outcomes, there might be, they may describe something like an immediate benefit for those who are participating in an activity. So that would be things like the knowledge or the ideas that the participants take away. So if you're working on a drug education project, that could be something like increased knowledge of the impact of the drug on health, or increased confidence to find alternative strategies for drug use. And then in terms of intermediate outcomes, in projects to raise awareness, intermediate outcomes would be relating to what the individual participant does differently based on the knowledge gained. For instance, the reduction in drug-taking behaviour. So longer-term outcomes are measured at a much later date, and they would, in this instance, if it was a drug project, it would be things like improvement in health, greater integration into the community, changes in policy or service delivery. And then the next slide, I've just put that up there in case people are having to work on outcome statements, and I wanted to give you some material to think about so you could have a look at that if that's something that you're working on at the moment. I'll just give you a chance to look at that. Okay, so seeing outcomes as being caused by particular interventions is a cause and effect model. So starting with this premise inevitably leads us in the direction of evidence-based programs. So they, as you know, are seen to have predictable, repeatable results as long as we strictly adhere to the program manual. So we use evidence-based programs to refer to the information of specific programs that have consistently been shown to produce positive results by independent research studies that have been conducted to a particular degree of scientific quality. So that's one way of having some assurance of what we're planning to do will produce good results, would be to select those kind of programs. But I question that if we're just using a relatively small number of flagship programs to inform us about what works, this can be limiting. Besides that, does this standard fit our purposes in our context? It can exclude us from a range of credible social scientific research designs in measuring outcomes. So in this case, the research task isn't to reduce to a minimum and isolate specific repeatable factors in terms of cause and effect, but it's to show relationships between the interrelated factors in often fluid and unfolding situations. So what I'm saying is that this requires an approach that understands, values, and then integrates different forms of knowing. So I would say that the proposition that the only route to reliable evidence comes through meeting the gold standard research is not something that I'd adhere to, because of the ground and the inherent complexity of youth and community work. Like I said, it requires a different approach. So I would advocate a more nuanced, evidence-informed approach based on the integration of experience, judgment, expertise with the best external evidence from systematic research. And you can see an example of this on the slide 12. You can see that evidence matrix slide there. So if you're working from left to right, there's no single category that would be conclusive, but the evidence becomes stronger and builds a picture as you go across the categories from left to right. I was just going to tell you a little story to finish off. And I worked in a community that was had a lot of antisocial behaviour with young people, and with other community partners we took different approaches. We looked at solving some of the housing problems, refurbishment of youth and community centres, involving young people, involving the community, and at the end of the day we got a lot of positive feedback. But one thing that a member of staff said to me who was very familiar with that community was, people are happier in this community now. It's a happier place. I just thought I'd tell you that story because it's quite difficult to measure that kind of thing, to capture it. But she saw a direct correlation between the work we've been doing over a couple of years and the actual climate of the community, the mood in the community. But at that point, I will hand you over to Christine, see if there's any questions.
Okay, so I will invite anyone who's online to type any questions you might have into the chat box. And then I'm just going to go ahead and unmute our calling in users in case you want to say anything. Feel free to jump in. Let's see if we can... Okay. Yep, if anyone has a question, go ahead and type it into the chat box. And in the meantime, just to kick things off, I'll start with a question of, Lisa, did you have any tips for once you've done the evaluation process and you have your results, in feeding those back into either your program or in presenting the results of the evaluation to the community or decision makers in the most effective way?
Yeah. Sort of. The thing that I've found is, obviously you have to do that thoroughly, but if you delay that process or omit it, you really can do a lot of damage in communities. In terms of, you need to not try to explain this, but people get tired of being asked their opinion, don't they? And tired of giving information when those results aren't seen to be put into practice. So I think if you can do that, even if you haven't got the resources to put into practice what people are saying, or you're not going to be able to do it in full, if you can get that information to the community quickly and effectively, then they see what they're saying is being taken very seriously. Does that help you?
I see what you're saying. Yes. So we haven't had any questions coming on the chat box. Are there any questions from the current users? Okay, well, if anything comes up, feel free to ask. Just a little, another, we should elaborate on, we already kind of addressed it, is any examples of what your process has been like at that crucial stage of deciding what kind of impacts or outcomes you want to measure? Maybe any examples of how you've gone about choosing those, or how you've consulted the community just to set out what kind of outcomes or impacts you're hoping to evaluate?
Yeah, I think I heard you there, Christine. You said that how do you refine what outcomes or impacts you want to see?
Yeah.
Cooperation of the community. Is that correct?
Yes.
I think that's where I've used a needs assessment, in terms of sometimes you've got some initial research, but then you can take that back and consult again with the community and say, this is what we think we're looking to do. What's your opinion on it? So doing 2 layers of work. Take your initial thoughts or aims and objectives. That I can give you an example, actually. We had a big project in the Sea to Sky corridor where communities had selected programming in a very thorough way, but that had been over a couple of years. So I took that information back to different communities, different Aboriginal communities, and said, this is what communities have asked for. Is this what you want to continue to do, and is this still relevant? And I think that's another way of refining what you're doing, but also creating that ownership. And then communities know, people in communities know what the issues are themselves. They know what the problems are, and they have the solutions. So it's another way of making a success of what you're doing. They usually can tell you what the problem is and what the solution is.
Yeah. Well, I've opened it up for any final questions before we close, but otherwise we can let people enjoy their lunches on this beautiful day. As I said at the start, this has been recorded, so it will be posted. Oh, we have a question come in. Okay, so this is from Rachel, and the question reads, well, I absolutely see the value of process evaluation. How do you respond to pressure to report on behavioral change/impact? I'm working with a program that's delivered at the community level, and we're looking at ways to assess changes in specific settings. And now she's just finishing up typing.
Can you say that again, Christine? Sorry.
Yeah, you know what? Here, Rachel, let's unmute.
Can you hear me?
Yeah, we can hear you.
Oh, perfect. Okay, I have like my earphones on, so I'm like using like my iPhone earbuds, so I wasn't sure if it would work or not. So yeah, we're working with a program, actually with the South Asian community in Surrey, and it really is a community engagement program where we're working with the temples and doing sort of health promotion work, and we're trying to figure out how to do the evaluation in that setting, because we're able to evaluate like some changes that are happening at the temple, so we can assess at the temple what the changes are there, but then it's really hard to tell what that means for the population who attends the temple. We've tried to do some individual surveys with people, but it's hard to engage because there is a very different sort of varying levels of engagement, varying levels of literacy. And I guess the concern is that if we sort of select some people to do a little bit more of a focus group or a survey with, that they're not actually necessarily representative of that larger congregation. So it's hard to sort of extrapolate that and say, what does this mean in terms of change for that larger community? And I guess I'm sort of grappling with how we might be able to measure that. Does that make sense?
Yeah, yeah. And if I've heard you correctly, because the line's quite bad, would you say that storytelling wouldn't work in that context?
It's helpful, and we are doing that, but I work within a health authority setting, so I mean, fundamentally, at some point, we need to be able to report back to decision makers on, you know, is this program worth the investment? Is it actually making changes in people's behaviors that are going to have an impact on their use of the health system and on their health?
Okay, and have you, because I don't know the program, would observation be appropriate at all?
I mean, I think it is, and certainly we can do observation in the temple setting, but again, it's how do we do that? I think part of the question is, and I think we have some ideas about how we can change the changes in that temple setting, but then I guess the intent of the program is that there'll be a ripple effect and that people actually may, because of some of those changes in the temple setting, actually take that home. I mean, most of the changes we're looking at right now are around diet. So we're trying to get a sense of, you know, whether people are actually making some of those changes in their diets at home as well. And again, I mean, I think we could definitely find like a sample of people who are willing to do a focus group or willing to do a survey. But my concern is that those wouldn't necessarily be, like, you can't really extrapolate that to the larger group. So if sort of people are looking at, you know, what does this mean in terms of potential population health impact? I don't really have an answer for them.
I mean, like I said, I don't know your context, but the other thing you can approach is in the sense of looking at the impact of service delivery and the changes in that way. That, like I said, it's not only an impact on individuals, it's how we operate as services and engage with those communities effectively. Documenting some of that as well.
Yeah.
So that you get more of a holistic picture.
Yeah, no, and we certainly are doing that, and I think I'm not sure. Like we've been thinking about this for a while, so I don't know if there necessarily is an answer out there. I'm just trying to figure out how to sort of bridge that gap between working in a context where a lot of the quantitative data is really what people are asking for, and I mean I think the stories are great and can complement that, but having that quantitative data is really ultimately what decision makers are really feeling that they need in order to be able to talk about the impact that the program may or may not be having, and then if it is having an impact, to sort of advocate for sustainability of funding and all those kinds of things.
Yeah, and it's almost, I know it's a big thing, but it's almost like educating the decision makers as well, isn't it?
It is, but I mean, I can also see where they're coming from, right? Because they're at a table where they're, you know, their discussions are with other, you know, VPs or other sort of senior level executives. And when we're talking about discussion of how funding is allocated, it's really easy to measure how, like, hospital-based services and the impact that that's having, but it's much harder from a population health and a community development perspective.
Yeah.
So I don't know. I've been grappling with this for a while, but I'm interested in your thoughts.
Thanks for that.
Okay. So so most of what you're doing is, and I mean, again, we are doing that storytelling, and we are doing some like observation in the temples and that kind of thing. I'm just sort of, yeah, I poll everybody with this question that I talk to. I'm like, oh, but just wanted to get your perspective on that. Okay, cool.
I can send Christine some references if that helps as well.
Yeah, no, that would be helpful. Thank you.
Hi there. Now, I see we might have a question from Anne. Anne, do you have a question that you wanted to speak? Okay, so Anne's question was that she said she's just curious on evaluating impact on a project that is evidence-based but need to find in a community. Let's see. I'm not sure exactly. Lisa, do you have a comment? Oh, but need to find a home in a community setting. Okay, so the question is, that's okay. It was it's that typo problem. So I think the question reads, just curious on evaluating impact on a project that is evidence-based but needs to find a home in a community setting. I guess getting it established or
she's trying to evaluate a project that isn't in a particular setting yet. Is that the question?
I think so, and feel free to jump in and clarify if needed. Yeah, I guess Lisa may be speaking to finding homes for evidence-based projects in community settings.
Oh, right. No, I don't fully understand the question. She's working on an evidence-based project, but she hasn't placed it within an organisation. Is that what your understanding is?
That's what I'm getting from it, yes.
So making those connections with community organisations.
Yeah, and I mean, if you have experience to speak to about that.
I think she's in a very strong position, actually. If I'm understanding what she's saying, I mean, that's what more and more funders are looking for, is that strong evaluation piece. And that's what, if she's looking for something like to place it in a non-profit setting, I think they'd be very open to that based on her evidence.
Oh, and just to clarify, they were looking to adapt their evaluation process so it better fits in the community. There we go.
Oh, I see. To actually tweak it so it fits better with the community. Yeah, I think maybe some ways of doing that is actually do some consultation and involve, if you have members of the community who have some of the skills to do some of the evaluation, start to do that at a grassroots level and take it down and test some of it in a very small setting before you roll it out. I mean, when I've worked with young people, they're so honest. They will tell you exactly what they think. So if you do try something else on them, you'll definitely get the feedback.
Okay, so I'll do the final call for questions. I don't see anyone typing, so it looks like that might be the close. Okay, so in that case, Lisa, I'll thank you for the time you spent preparing and for sharing your experiences. And if people have follow-up questions, I know that they can find you online on Lisa Paterson Consulting and I guess on the Community of Practice website as well, because you're also a member.
Yeah, and I can send you a couple of references in relation to those questions as well.
Yes. Okay, well, thank you very much, everyone. I hope you get to enjoy some sun out today, and we will be posting the slides in the coming weeks. Bye.
Thanks.